Our first speaker is Dr. Saleh Fares. Actually, it's not necessary to actually give detailed explanation who is this. Actually, our president of Emirate Society. So, Saleh, please.
Thank you, Albert. Assalamu alaikum and good morning, or good afternoon, everyone. I think we'll speak in English just in case someone is not Arabic is not his first language. But I think, first of all, on behalf of the Emirate Society of Emergency Medicine, I would like to welcome you all. And I think this is our first time to do this in a medical conference. I think this could be one of your earlier or a few conferences that you've been to. The purpose of today is basically to give you during your medical school some idea about what we do and what we want you is actually to think and consider emergency medicine as a future career. Going back to my medical school, honestly, I didn't have the chance to know more about emergency medicine or to consider it. And during my residency, I'll share some of my experience with you. Honestly, it wasn't easy. I remember going to, after medical school, going to my first day of emergency medicine residency in Canada, carrying a family medicine book, which, I thought it's a general emergency medicine, and that was my first day. So I still have the book, and I just don't want you to do the same. So we'll try to share some of that. We have a question, and I don't know whether it will be, I have nothing to declare. Okay, I'm just here for emergency medicine. I'll continue to do that. And what I'll come back. Can we put the live pooling? We have a simple question. Just I need to know from the audience. Have you downloaded the app? No? Okay, I think that if you could download it, okay, we'll ask toward the end of the talk. If you could download it while you're doing, we're just going to survey some of you about your opinion on that. I wanted to compare pre and post. But I think we'll just do a post after. Can we put the PowerPoint again? Yeah. So beyond medical school, honestly, I think many of you think that after graduating from medical school, it's the end, okay? And, you become doctor so-and-so, and it's the end of, misery and exams and long nights. Or making money, and you will be this famous doctor, or you're going to have this limo car, in the front of your door. But believe it or not, I think this was my dream too, and unfortunately it wasn't true. I'm just going to give you a very brief overview. It's very quick. We study years in emergency medicine, but it's just the point of it, what is it, and how it's making a difference. And how to select your career path in general, not just in emergency medicine. I will give you some of the options of fellowship. So maybe some of you may not like emergency medicine, but then he likes some sort of related specialty to it, and then you become what we call it a fellowship that I also recommend some. Recommendation for successful career, and also think beyond emergency medicine in general. So the specialty, emergency medicine, is very young compared to all, I'm sure you heard, and you're doing ophthalmology, ENT, neurosurgery, but emergency medicine is one of the youngest, specialties in the region and in medicine also. Advantages, it's very intellectual challenges, it's very nice, a specialty to go through. Job satisfaction, a lot of our guys are very satisfied with the way we do emergency medicine. Personally, I've been doing what now? 14 years of emergency medicine, and I haven't had 2 shifts together or alike. Every shift is a different shift, every patient, and that's, for some people, is the attraction. I hate going to work every day at the same time and leaving office at the same time, okay? Part of my job now is administrative, and I hate that part, okay? So I love, and I still go back to my emergency medicine and continue for those people who work with me. The second thing is the lifestyle. If you don't feel, you have a wedding or something, you can switch your shift. Okay, there's no clinic. We don't have like 3 months waiting time or something like other surgeons that he needs to be there. No, oh, Dr. Nuruddin, do you mind swapping a shift with me? By all means. Not when you're wearing the kandura here. You're going to scare the patients. So, and also sometimes like higher salaries. Emergency medicine, if you do shifts, if you work more, you get more, and many advantages. So I did medical school. Maybe I was wrong showing my medical school year, but yes, 20 or 20 something years ago, I did medical school in Ireland. Very nice time at the time. And then after that, I went to Canada, and this is what I mean. You know, during end of my medical school, I had no idea. I've seen emergency medicine, what's called in Europe at the time, accident and emergency, but it wasn't a specialty in Europe. So I went back, you know, during medical school, I had a few stories, but which made me consider emergency medicine as a career. Alhamdulillah, I went back, did, during my internship, did the Canadian exam, and alhamdulillah, I applied and got accepted at McGill, which I think was a very, alhamdulillah, successful time during that. During my residency, we did 5 years of residency of emergency medicine. Then I decided to do EMS, or it's pre-hospital care, which all of you may know, like ambulance services. There is a physician who supervises the ambulances called medical director. And I trained to be a medical director for 1 year. And again, very beautiful you know, time near Niagara Falls, if you heard about it. Then went to Boston to do a disaster medicine fellowship. Okay? And again, very interesting specialty, but also in a very beautiful city in Boston. And I'm still working on it, Master of Public Health and Doctorate of Public Health in Johns Hopkins, Baltimore, very beautiful place. So honestly, I think I'm still satisfied of my academic career. It's been very fun. And if you're still looking for a fun career, you know, please come and see me. And I want you to think of specialties as a positive thing in your career rather than just another hurdle or another bad thing happening to you. How to choose a specialty? That's again, it's your personal interest. Okay, so I'm sure not all of you would go into emergency medicine. Some of you may consider surgery, may consider a different thing. But think of yourself. What is your personal preference? You know, I didn't like you know, surgery, let's say, pure surgery. Being in OR for a long time, I didn't like it. But emergency medicine was balanced. I still do surgical procedures, and I still do the medicine. So it gave me that personal thing. Availability. Okay, females, they need maybe to think of their social life, married, kids. These are things that may or may not happen. Neurosurgery, very rarely a female to go into neurosurgery is just a killing specialty for some of them. Future opportunities, some are the same, you know, just specialty that you don't progress. So you need to think of that. Ask mentors, and this is what I did during medical school. I've been asking so many people, you know, what shall I do? An emergency wasn't, to be honest, one of the highest ticks because it wasn't known at the time. Long-term skills, what do you need to keep, what do you don't want to do? And extra time, okay, if you want, you know, extra time to, again, back to the family thing, social reasons, I think I mentioned that, and limited exposure. If you want to be so focused or wide in terms of your specialty. Do your homework first. I think getting into your specialty, you need to do your homework, okay? Preparing good, and that's why we made this track. I think you'll be hearing from the experts how to make it a strong CV, how to really impress them during interviews, okay? Do electives, okay? I've seen CVs with 2 pages or 1 page. And when I sit with the medical student, have you done this? Yes. Have you done that? Yes. Have you done research? Yes, I worked on this. Have you been to a conferences? Yes. Why you didn't mention it? Oh, no one told me it's important. So a lot of these things that impresses people, it doesn't have to be a publication somewhere in a big journal, okay? But at least you've tried or you know what is research is. Interview skill, I think we covered that. And the vision for your future. You also need to decide what is it. We cannot give you what you don't have. Okay, we try to help you, to guide you and to get you through your career. So you need to make that call. You need to exercise. Don't think you'll be sitting back and we feed you information. You need to go and look and speak, work in the emergency department, and get the feeling of that. Very quickly, I think many of you, maybe it could be an older generation, Okay, but few of our colleagues here may see this is the emergency, the ER series. Very action oriented. Many also came up after. But our specialty is basically, what is. I think, we discussed it also even on breakfast today, that many, especially cardiologists, his specialty is the heart. A neurologist is the brain, right? Nephrologist is the kidney. But if you ask emergency medicine, what is the specialty, what are their organ, our problem is the time. Okay, so we are running against time and also trying to compete. So STEMI or ST elevation MI has 90 minutes to meet. Stroke has this minutes and this and that. So we're going against time for many diseases and also trying to make the biggest decision that we make on every patient we see. Why is he here today? And what will kill him or harm him before he's going to that, if he comes in with chest pain. Before seeing the cardiologist, what is the time-sensitive issue that I need to deal with? Okay, so that's our specialty, basically. In a very graphical, I try to put it in a very graphical way. If you think of cardiology as a specialty, okay? So it's like a column. We studied cardiology in medical school. So that's the basic, and this is GI, this is pediatric, this is ortho, and so forth. And medicine goes on and on in different specialty. So we learned much of those, or specialties in medical school, okay? But in there is more than just, if I tell you now, can you treat a trauma, sick trauma? You'll tell you maybe no, right? Can you treat a cardiogenic shock? I would say yes. Yes, you've done it, you've studied it, but maybe you are not comfortable in dealing with it. So the emergency in every specialty, there is an emergency. Okay, in cardiology, as I mentioned, cardiogenic shock, STEMI. In GI, there's GI bleeding and so on. In pediatric, our experts are here. Also, many pediatric emergencies. Okay, just for pediatric. And. So the yellow part is this, emergencies in those specialties, okay? When you look at that, there are things beyond us. I don't need to know how to put a stent or to do an angiogram, okay? But I know how to, I've seen it, I work with them. So that's the cardiologist should know, okay? And then at the peak of that, there are extra subspecialties in any field, okay? So basically, we have our fundamentals in medical school. We have emergencies in every specialty. And we have things that are very advanced. And there are things that even very micro in medicine. Okay? Our job in emergency medicine is to focus on the emergencies in every specialty. Okay? So that's why when I told you it's not a criticism to family medicine or a general practice, but they know much of the basic sides of medicine or the fundamentals, we call them, and they can manage that. And then in emergency medicine, we take care of the sick patients in every specialty. So that's why part of the fun we do that we could expect any patient coming down the road, from pediatric or newborn all the way to a geriatric with a fall or a coma. So I think we covered that. So emergency medicine is very, very fast-going, very exciting, different, diversity, broad spectrum. It gives you could help yourself at home. I think we're one of the few specialties that you could do a lot at home before. My wife hates me for this, okay? She thinks that I'm not taking my kids to the hospital every day, okay? Or when they have a fever. But I know, okay, that there is nothing much. So when she comes back from the clinic, I tell her, okay, you know what, go take them if I think I'm not a good doctor, and I'll tell you what they will bring. And I'll tell her, you see, this is the bag that you brought it the last time. Okay, antihistamine, paracetamol, which we have it up in the pharmacy, okay, at home. Okay, so again, emergency medicine could do a lot. Suturing, this and that, it helps you with your specialty. I'm gonna run through those and I'll allow my colleagues to take on, is basically the future. So emergency medicine, shift-like, work, diverse, but also you could do more of this. We have very expertise now, alhamdulillah, among the UAE here, who we graduated. You could do into toxicology, okay? Our, mashallah, professor here, been through toxicology. So emergency medicine also, you could do it through pharmacology or through emergency medicine. You could do a fellowship in ultrasound, pure. Dr. Arasha is also our expert in this. International emergency medicine. The fellowships are the subspecialty, the top thing of emergency medicine, which I told you. After general emergency medicine, you go and do a fellowship in one of those careers. And they are increasing now, as you could see. Inshallah, by the time you graduate, it's going to be even much more. Okay? There are websites, academic websites that can guide you through. I remember when I finished my residency and finished EMS, I was looking for a disaster medicine fellowship. So I went to the same website, okay, and looked for and contacted different universities for that. Same thing. So everything is widely available, and you could reach out to this. And you will be amazed. Geriatric emergency medicine, okay? Hyperbaric emergency, injury control, so legal medicine. So a lot of things that if you have like, a background of legal, or your sister or brother or someone with a legal background, you may consider many of those future careers. So don't look at emergency medicine as very limited, rigid specialty. It's actually very wide and very broad. Pediatric emergency medicine, we covered that. Sports emergency medicine. A trauma, a subspecialty and fellowship in trauma. You finish emergency medicine, but you purely go into trauma. Intensive care unit. If you want ICU, there are things that you could do also. EMS, I've done that. Also working with the ambulances, going out. This is not ER-based or emergency department-based. This is out. You go and work in the ambulance, helicopters, and you evacuate patients. Very nice specialty. I've done it in Toronto at the time. It was very nice time. Disaster medicine, also same thing. Planning. I have a background of that, as I mentioned, and I'm involved at a national level currently with this. Very exciting. How to look at the system as a whole and work with that. Pediatric, we cover trauma, toxicology, sports medicine. Mahmoud Al-Jufaili, who's my classmate in Canada at the time, he's the official doctor of the Omani first team, Muntakhab Al-Omani. He's the doctor now. So again, there's a lot of excitement in that. So administration, also if you like administration, you could work with that. Okay, medical education. Many of our colleagues now taking emergency medicine and studying medical education to pursue academic and emergency medicine. Medical informatics, one of our emergency physicians have done IT. If you don't have background in IT, you may do this. Public health, international emergency medicine, and simulation also in terms of training. So the question, is it the end or the start in medical school? Okay, it's actually the start. Okay, so it's the start of your career. Okay, and so in summary, please consider emergency medicine as a future career, and also do your homework first, which we will try to help you with. But again, we're happy to help you with that.